Everyone, and welcome back. I hope you've enjoyed your lunch. I hope you enjoyed your earlier workshops. I thought we started off with some really amazing sessions this morning. I was really moved by Farzana in particular. And we have some great speakers lined up for this afternoon as well. Warm welcome as well to everyone joining online, and thank you so much for all the kind of questions and comments that have been coming in. It's been really nice to feel that everyone's been part of this conference, as well as those in the room here in London. So just remember again, if you are attending online, you can put your questions in the right-hand sidebar. And if you are attending in person and you haven't already tried the app, I've been told it's a great app, and you can put your questions on that, and I can put them to our guests. We still have 2 rounds of workshops to look forward to, and we're finishing with the keynote from Charlie Massey, who's Chief Executive of the GMC. But right now we're going to have a really interesting kind of double keynote presentation, and it's on one of the scandals that has been such a big story in the news, and it's a thing that sort of, drives fear into the heart, I think, of anyone who ever thinks that they might want to start a family, which is the scandal that's been revealed about maternity provision. How many years, how many women have been complaining, how many medical professionals have been ignored. And what we have now are 2 remarkable women who have kind of put their experience to try and improve things for others. So we're going to be hearing from Tinuke Awe, who's co-founder of 5X More. She initially had the idea to join forces with the other speaker, Chloe Abe, after her own personal experience and through speaking to many black mothers through her social platform, Mums and Tea. The platform is a safe space online for mums to come together and support one another. And in 2018, when she first heard of the shocking statistics in black maternal health, she felt compelled to take action. So 5X More is committed to highlighting and changing black maternal health outcomes in the UK. They're trying to support women with resources, train health professionals, and lobby for change. And she is herself a mum to 2 children. Chloe Abe, the co-founder of 5X More, is also the founder of Prosperities, a maternal wellbeing social enterprise which supports black and South Asian people across the UK. And I think we're going to hear from both our speakers is their passion for well-being for black and South Asian women during pregnancy and in the year after. Chloe as well is a mother, and as we know, there is so much anxiety as there is about childbirth and motherhood, and the idea that certain groups of women are suffering an even greater disadvantage for which we can find nothing except their ethnicity to blame is definitely a crisis we all need to look into. So please welcome Tinuke and Chloe. They'll give their presentation and then we can have some questions. Welcome.
Hello, thank you for having us today. So we are Chloe and Tinuke. We're going to be talking about tackling health inequalities in maternity. So to give you a quick disclaimer, the UK is still one of the safest places to give birth in the UK, but there is a disparity in who is dying. Black women and birthing people are not a monolith. We do not all think the same or have the same experiences, and we as 5 Times More, we do not speak on behalf of all black women. Quick trigger warning, some parts of the presentation, you will hear certain things about women's traumatic experiences and historic violence against black people. So in 2018 and 2019, the Embrace report said that black women were 5 times more likely to die during pregnancy, childbirth, and 6 weeks after, compared to their white counterpart. In 2022 and 2021, it's gone down to 4 times more, which sounds brilliant, but it's still not enough.
So, what is 5 Times More? We are a grassroots campaign, and we're committed to highlighting and changing the maternal outcomes for black women and birthing people in the UK. We do this in a number of ways. First of all, first and most importantly, we give resources, free resources to black women who come to us. So we offer free hypnobirthing courses, and we have a range of different fact sheets on our website, so women can go on there and get information about various things. We also train health professionals, so we're very big on, look, you can't change something that you don't know about, and in running 5 times more, we've seen that a lot of health professionals don't actually know that this is a statistic that is going on right now here in the UK. They think it's something that's happening in America, and it's not actually something that's happening here. So first and foremost, you know, you've got to highlight, and then you change. So we are very big on training health professionals as well. And we lobby. So the next slide will show our parliamentary efforts, the next slide will show our parliamentary efforts, but we are very big on, okay, right, we've raised awareness, we're trying to change things with the women on the grassroots level. What can we do to make sure that the people in power, the people in charge, the people that can actually make these changes actually do to listen to us and to make these changes, because it's been a long time coming. So Chloe mentioned, obviously, in 2018, those were the statistics, but actually, if you look far enough in the Embrace reports, this is something that has been going on for decades. This is not new information. Black women have indeed had the highest risk of dying in that period for a long time. And who are we? Obviously, I'm Tineke. That's me, heavily pregnant in this building. Actually, we took that picture over there. Just before the pandemic, I was pregnant with my little one. She's 2 now. We were here for the RCOG Let's Talk About Race event.
Just before lockdown.
Yeah, literally like a couple of weeks before lockdown. But yeah, that's us. I run Mums and Tea. Mums and Tea is a social platform for black mums to connect. I was the first one out of my friends to have a baby, and I didn't want to be alone. So what I did was created a platform for mums to connect. I've heard of social isolation and depression, and I just wanted to bring mums together, get out of the house, have a cup of tea, and make some mummy friends. And through that social platform, I was hearing a lot of other black mothers sharing their experiences of giving birth. Mine was not too pleasant at all. I won't go into the details, but just so you have an overview, I had preeclampsia, which was diagnosed very, very late in my pregnancy, and it led me to be induced, and the experiences that followed that it just wasn't a very pleasant one. It left me feeling like I wasn't important, like my pain wasn't taken seriously, and that I just didn't matter.
So running Mums and Tea, I found out that a lot of other black mums felt the same way. They were having really poor outcomes, such as mine, and were actually having other things such as like sepsis or infections or really terrible outcomes happening to them. And I was like, something's going on here. I don't understand quite what. Then the Embrace statistics came out in 2018, and I was like, no, we've got to do something. So because of what Chloe runs with Prosperities, I was like, well, you work in maternity services, you actually have a social platform as well for maternal well-being. Why don't we scream and shout about this? Why don't we try and build a campaign? From someone who's never done a campaign, never run a campaign before in my life. But I was just like, it was just too important to not do something. So that's why we started 5 times more. As I mentioned, here are some of our parliamentary milestones as well. I won't go through everything, but in 2020, we had a petition that gained over 187,000 signatures, which we're really, really proud of, because it then led to black maternal health being debated in Parliament for the first time in its history, bearing in mind that this actually hadn't been spoken about at all, and this has been going on for a long time. We have submitted both written and oral evidence to the various select committees, and we launched the all-party parliamentary group for black maternal health last year, and a couple of weeks ago we actually had the first meeting in the House of Commons, which was amazing, and hopefully we'll be able to get a chance to invite you all to one of the ABPG meetings so you can see us in action. So, what are some of the issues that black women go through? So obviously, like we mentioned, we run 5 times more, and outside of 5 times more, we are also supporting a lot of black women, and we're hearing a lot of the same things all the time. So first and foremost, not being listened to, feel like they're not being taken seriously or believed when they are expressing themselves, when they're saying they're in pain, they're not being administered pain relief, they're not on time or at all. Sometimes black women have reported that they're made to feel like they are uneducated or they're spoken down to. So in some cases, this is, we call this being gaslit, something that you know to be true and someone is telling you, no, that's not true. Sometimes black women have reported that they can often feel like a burden, and this can prevent them from speaking up. They don't want to present in hospitals, or they don't want to go to the day units because they're like, oh, I don't want to be a burden, I don't want to disturb anyone. So that can often prevent them from getting help on time. This one is one that comes up a lot, actually, being stereotyped as loud and aggressive and angry, and that inhibits a lot of women from speaking up. A lot of women have reported that, you know what, I just didn't say anything because I just didn't want any trouble, and that is very, very sad to hear. Being labelled as strong and that they can handle pain. This is, again, something that we'll touch on in later slides, but being able to handle pain and being strong means that sometimes black women are left to their own devices in hospital settings, and because they're said, well, you're strong, you can handle it, you're a strong girl, and actually some serious things are really happening. And the last one here is that they're not often given the right information to make informed decisions about their care. So with one of the oral evidence, thank you, with the oral evidence that we gave to the Health and Safety Select Committee, we held a consultation with over 400 black women, and we wanted to ask them about the advice and the guidance that they had been given. Now, we saw that the majority, 55% of women, had been told about vaginal births, but actually, when it came to home births, water births, C-section, and assisted births, they were not told, they were not given any information about any of these births. And of course, that's a huge barrier, because if you don't know what all your options are, you can't make informed decisions about your care. This is Nadine Dorries. She, at the time, was the Minister for Patient Safety and Suicide Prevention, and during our historical debate, the first one, we heard that she was looking for, she had a call for evidence at the time, and it was from the Women's Health Strategy. And she, in the debate, she said, we are actually looking for the voices of black women. Black women are, and ethnic minority groups are underrepresented in the responses that we have received. And Claire and I sat there and we were like, we are so tired of hearing, we can't find black women to take part in research. We can't find black women.
They're hard to reach.
They're hard to reach. First of all, have you been to Peckham? We don't all populate in Peckham, that was just a joke. But we were just so tired of hearing, we can't find black women don't engage, and we wanted to do something about it. So,
My turn now, finally. So what we decided to do was to launch a survey 2 days after, called the Black Maternity Experience Survey. So we had over 1,300 women fill out the survey, black women fill out the survey, women that they cannot find. Within the first 24 hours, 500 women filled out the survey. So the survey was carried out. We had information from women from Scotland, Northern Ireland and Wales, and it was from women who gave birth in the last 5 years. Okay, so from our survey, this is some of the quotes. Not all of the quotes we heard were negative. We had some very positive stories, because we were looking for positive stories as well, not just negative. So I'll read some out for you. I was made to feel too young, black and not affluent enough. I just felt generally that I had to push harder for my concerns to be taken seriously. 2 midwives made bizarre claims about how childbirth and nursing should be easier for me due to being black. One midwife, when doing a sweep, said the reason for dilation taking so long for me was probably due to my African pelvis. And that's not the first time we heard that one, actually. Even though I was on my pain relief, I was mortified that she actually believed that there was such a thing as African pelvis. We had another girl who gave birth, who said, the midwife said to her, your pelvis did that black girl thing. Yeah. Look at everyone's face. Everyone looks so shocked. So the black girl thing is that, at first when they presented in hospital, they were high and free, and then
all of a
Dilate.
sudden they dilate and, you know, baby's ready to come. And apparently that's called
The black girl thing.
Yes.
Yes. I can't stop watching everyone's faces.
So I really want to paint a picture for you here. The statistics that we see and the poorer outcomes that we see do not actually end up mortality for black women. Unfortunately, for every death, we know that there are 100 near misses, so that there are 100 black women who are suffering from morbidity, so things like illnesses,
Right.
those near misses, those near miss,
Disabilities.
they're left with disabilities, like Sharmika, for
Yeah.
example. There's a lady that we support within our campaign, Sharmika. She was around, how old was she when she first, she was about 20 or so?
I was going to say 19.
Yeah, she was
a
about
young
19
mum.
or 20. Yeah, she was a young mum, but she gave birth about 7 years ago, and she is still in pain to this day. She's still taking pain medication, pain relief, because she had an infection that wasn't caught on time. She presented to the hospital, and
More than once.
More than once, and they kept sending her back saying, "Oh, you're sweating because you're breastfeeding, and you're new to breastfeeding, and that's why you're sweating through all your sheets." Turns out she had an infection, and it wasn't until one of the nurses on the ward actually took her seriously, and she had to be taken into surgery.
That same day,
But she suffers with a really terrible condition in her spine, and it affects the way she walks and she interacts with her child. So those are the near misses that we're talking about, the things that are just not picked up on time, that are not recorded anywhere. The miscarriage rates are over 40% higher in black women. Black women have a 2 times higher rate of stillbirth. They're 25 times less likely to access fertility treatment, and 7% less likely to be successful in comparison to white people. And postnatal depression or anxiety is also higher in black mothers as well. So we've looked at a little bit about maternity. Let's look at black health in the wider society. So we know that stillborn and infant mortality rates are highest amongst black and Pakistani babies from black and Pakistani backgrounds. We know that they are more likely to suffer from hypertension and stroke and sadly die from that, and they also have strokes at younger ages. Diabetes is a lot higher, it's 3 times higher in the black population than in the white population, and they're also dying a lot more from diabetes as well. And that prostate cancer mortality is also highest amongst black males. Now, this slide next is going to talk about medical racism and racism over the years. So the first picture is in reference to the godfather of gynecology, Dr. James Marion Sims. And I'm sure a lot of you here may use the Sims speculum within your vaginal examinations. But a lot of people don't actually know what the history behind that Sims speculum is. So unfortunately, at the time, this doctor was a very prominent doctor, and he did some very inhumane things to some black slaves under the guise of, well, black people have different nerve endings, they don't feel pain, they have thicker skin, and they're stronger, you know, they're subhuman. So he perfected the instrument on these black slaves, and then he took it into hospitals, and under anesthesia with white women, he used the Sims speculum. But actually, if you look at the textbooks and the journals from the time, it's all there, you know, that notion of black people not feeling pain and black people having different nerve endings. And we see that play out over time. The picture underneath that of the man looking like he is administering some injections over there is in reference to the Tuskegee trials that took place in America. This is with some black men that had syphilis, and actually it was advertised that these men would get some free treatment for their blood, and it would, you know, help make their blood better. They actually didn't get the right consent, and they actually did some really, it was awful. They were given placebos, actually, and they weren't given penicillin, which could easily treat syphilis. And what they did was they wanted to wait see how the syphilis would play out in their bodies.
Now, a lot of these men could have actually avoided a lot of harm. They were injured, they were blinded, and they actually, a lot of them passed away as well. And they passed the syphilis on to their children and their wives and other members of the community. And that obviously led to a lot of medical distrust around the black community. So, you know, obviously now we see vaccine hesitation and that kind of thing. It stems a lot from things like this. The next picture is of a study that was taken in 2016 of some medical students and soon-to-be doctors. And a lot of them held some incorrect biases on black people, that they had thicker skin, that they had less nerve endings, and that they attributed higher pain tolerances to black patients as opposed to white patients, which meant that essentially they didn't give them enough pain relief on time, if at all. In 2012, the publisher Pearson published a nursing textbook, and there was a chapter called Cultural Differences in Response to Pain. I'm not sure if you can see very clearly, but yeah. It says things that, I'll just read this one out. Blacks often report higher pain intensity than other cultures. They believe that suffering and pain are inevitable. Jews may be vocal and demanding of assistance. They believe that pain must be shared and validated by others. Hispanics may believe that pain is a form of punishment and that suffering must be endured if they were to enter heaven. Now, none of this was actually based off of evidence, and it's essentially telling the students to ignore people's pains based off of their race.
Did you say when it was taken off? 2017?
Yes. Oh gosh, yes. Sorry. So it was published in 2012, but it wasn't until 2017 when the BBC picked it up that they recalled. They recalled the books back. So for a good 5 years, there was a whole heap of nursing students that were reading how to administer pain relief to people based off of their race.
So what are we doing, what are we actively doing to change maternity outcomes? So what we have done is we have worked with St Thomas Hospital to launch the I'm Here to Listen badge. I'm not sure if you can see, they've got a little black badge on them with a hand like this, and it says I'm Here to Listen. So this is a reminder that the health professional wearing the badge is taking active steps to make sure they are looking after black women and that they have done our training, but also it's to show the women in their care that they know about the disparities that black women face, and they're taking extra care to make sure they look after them.
So actually, a funny story that we were here last week for the royal visit, and we spoke to a few doctors who worked within, was it St Thomas's?
St Thomas.
Yeah, and they mentioned how whenever they walk into the wards, a lot of midwives are so keen to show them that they've got the 5 times more badge and they've done the training. So we're happy that at least it's working, and people are proud to show that they've taken the 5 times more training seriously.
And this is one of the quotes testimony from someone who messaged us on Instagram. I gave birth 3 days ago. One of the midwives had a 5 times more badge on. I instantly felt safer, and I could feel that she wanted that too. She was very supportive and informative. Keep up the good work.
Yay!
And then we also launched the colourful wallets, if you can see them. So it's double-sided. And the wallet aims to empower women to advocate for themselves and to promote healthier well-being in order to create safer outcomes. So we designed the wallets to hold maternity notes, and on both sides there is information on when to come to the hospital, when to call your midwife, what to look out for, anything to do well-being, so go for a walk, drink water, exercise, etc.
We're actually really proud of these wallets. So we held the pilot last year, and we have a few hospitals in South East London who have actually...
All the hospitals in South East London?
Yes, actually all the hospitals in South East London, which is where we're from. Don't know if that helps, but hey. to commission the wallets. So hopefully, you know, we will see a lot more women from black and ethnic minorities with the wallets. They know when to present to the hospitals. They know when to speak up, how to speak up, and that kind of thing. It's really important for us that, you know, we're
ensuring that women can look after themselves, empower themselves,
Exactly.
advocate for themselves.
yeah, because we hear a lot of the time that they feel like they can't speak up, or, you know.
And actually know the signs as well.
Yes, exactly. It's really important.
So we also launched the 5 steps for health professional with RCOG, actually. So this was that was our first partnership, wasn't it?
Yeah, it was.
Yes. So if you go on our website, there's more details, but here's some of them. So it's listen, remove any barrier to communication, check you're providing clear information, provide access to detailed documentation, and be a champion. And then we also have our resources on our website for black women. This is some of them. So we have 6 recommended steps for black women that they should take, 5 recommended steps for partners, because we also have to include partners. We worked with AIMS about know your rights. So what are your maternity rights? What do you have access to? And just in terms of, the birthing options.
Yeah.
What are your birthing options? So a lot of women don't know about the birthing options. How to make a complaint. We did that with Clifford Chance, who gave us pro bono work. Hypnobirthing. So every month we have 100 hypnobirthing courses that we give out to black women for free, and we do that with Positive Birth Company. When to call the midwife. That's a partnership that we have with Tommy's. Group B Strep. That's brand new that we started it with them. Just raising more awareness around Group B Streps. Kick count as well, when the fetus is not kicking, when do you go to hospital, when do you go to day assessment unit. So I used to work in day assessment unit, and a lot of the times the mums will say, I haven't felt my baby kick for 3 days. And I'm like, why didn't you come in? Oh, I didn't want to waste your time. Oh, I thought it was nothing. I got told to eat chocolate, I had that one. I got told to have a bath, but I didn't feel nothing. And by the time they come, sometimes it's too late. Questions to ask at your appointment. So that can be about flu jabs, it could be about whooping cough, antenatal appointments, how many appointments you should have. So different hospitals have different amount of appointments. And we have other resources on our website, but we have a lot.
And many, many more.
Yes, we have a lot. We're making sure that black women are really equipped, but all women as well. So even though 5 times more about black women, if you go on our website and you're white women, you can still use our resources.
Yeah. So, Mind the Gap and the Hotano platform. So a lot of you here may know of the medical student Malone Mukwende. He went viral a couple of years ago because he produced this Mind the Gap book, which is a handbook of clinical signs in black and brown skin. Now, that's important for us to support. Yes. I'll give you a little bit of a story. So a couple of months ago, my son's nursery had an outbreak of hand, foot, and mouth. And I was told to go onto the NHS website and look for more information. I did, and I was disappointed to see that there were only images of white children. So I was frantically searching for what it could potentially look like on my son, and I couldn't find anything. So me being me, I called them out on social media. I sent a really angry tweet, and I was like, hey, what's going on? How come you say you're the NHS and you're for everybody, and I cannot see what hand, foot, and mouth looks like on black skin? So books like this, resources like Mind the Gap are so important, and we're very proud to be a part of their Hutano platform, which is a social platform for black and brown people to come on and give pictures of what their conditions look like. So we have a resource, because clearly NHS isn't really doing well on that front for now. I have spoken to them, and they've said that they are working on trying to improve the diversity of the images on their website, but for me, it's just not quick enough. Yeah. So, what is actually important to black women? As I said before, we are speaking to a lot of black women all the time, within 5 times 1, outside 5 times more. And we're black women ourselves, obviously. So we want to, first and foremost, we want to be listened to. That's something that comes up time and time and time again. We want to be listened to. We want to feel like we are the center of our care, so to be given individualized care and not treated like, oh, well, you're black, so you fit under this category. It should be individualized, personalized care. We want to feel like we're important because for a very long time, we haven't felt like we are. How do you speak to black women? Ooh, this is a question we get asked quite a lot. And it really, I see a lot of you, a few of you are laughing. Yeah. Just don't even know what to say. When we get asked this question, we got asked, the first time we got this, asked this question was by someone very, very senior.
High. She worked in policy and advisory.
Yep. She was like, how do I speak to black women? And we were like, how are you speaking to them anyway? What were you doing before? It should be with respect and with dignity. And Chloe often says, well, we're not giving birth on the street. We're in the hospitals, so you can speak to us right there and then. How do you speak to black women? Like you would literally speak to anybody. And if you need a translator,
Use one.
use one. We are starting to reject the notion of being a strong black woman. I am not a strong black woman. I am a black woman. I don't want to be seen as strong, because if you label me as strong, then you will put this sort of notion of, well, you can handle it, you can take it, you can do anything, you're strong. Actually, no, I can't, I'm weak. I'm weak, I'm very feeble, and I want to be vulnerable too. So a lot of black women, especially over social media, are saying, look, rejecting the notion of being a strong black woman, and we want to have a certain level of vulnerability. The last one, and for me, this is the most important one, is to be shown empathy. So giving birth is such an important milestone. You always remember how you were made to feel and how you were treated. When I started doing collecting anecdotal research before starting 5 Times More, I was speaking to black women in the community, and I spoke to my mum. My mum gave birth to, hey, show my age, me 30 years ago, and my brothers and sisters around about 25 years ago or so. And she was brought to tears when she was recounting her experiences of giving birth here in the UK, because she was left traumatized, and those experiences have stayed with her. So for me to see my mum as a 60-year-old woman crying because of the trauma and how she was made to feel, it really spurred me to do something. But I think for a lot of the health professionals in this room, it's important to show a little bit of empathy, because we always remember how people, not necessarily what people say, but how you make them feel.
Okay. So how do black women think maternity services can be improved? So in our survey, that's the question we asked, and here's some of the responses. There needs to be, let me read from here actually.
Yeah.
There needs to be less stigma and stereotypes around how pregnancy and labour should go. Engaging, listening, and believing black women at all time. Black women have the same skin and blood as everyone else. Therefore, we experience pain in the same way. No, I'm not a strong black woman. I am a woman who is asking for help. Please listen to me. Listen to the concern people have. No matter how much you think they are moaning, a life is a life, in this case, 2 or more.
I think healthcare professionals need to be trained on how to treat patients fairly, regardless of their ethnic background. If there is a language barrier, they should get a translator. They should also include communication skills in their syllabus. I find that the majority of midwives I have encountered, either as a patient or in my job as a doctor, are quite verbally aggressive and sometimes combative. Thank you for listening.
Oh my God, what a presentation. Now I know that we haven't got much time, but I just think what we're going to do is we're going to run up close to 2, and then you can go straight to your next workshop. But I think everyone agrees that I need to decompress a bit. I'm just taking in everything. And looking at the questions that have already come in, inspiring works as well. It's outright wrong that these things happen and high system level change is clearly needed. What, if any, challenges have you found when trying to affect change at that level? Because you have spent a lot of time now talking to people at quite senior levels. So what are the areas where you're meeting the resistors? What are the problem areas?
Ooh, talk about the training.
That's a good one,
Yes. So one of the challenges that we're facing is people thinking that we're saying that they're racist. We're not saying they're racist.
Yeah.
We're just saying that, black women are dying and we're trying to create a change. I'm trying to think of the quote from the training.
I can't remember the specific
What
quote,
was it?
but I remember quite a senior person that was on the training getting almost defensive.
Yeah.
And we were like, look, this is not an attack. We're not here saying, all health professionals are racist, every white person in here is racist. It's not about that at all.
Far from it.
It's far from it. We know that actually it's the system that plays a huge part, and the curriculum and all the different things that we've mentioned, the unconscious bias and having to move towards conscious inclusion rather than just going on an unconscious bias training. It's not enough. We're not saying that, oh yes, it's that, but sadly, we're seeing a lot of people, kind of pushing back and feeling like we're attacking them.
Yeah, no, well, thank you for raising that. So Hania asked, how can we try and get these wallets implemented in our trusts? And when can we get our training to get a badge? So, you showed the sort of system that people can sign up for. People want to do that. Where should they go?
Email us.
Yeah.
Yeah, that's it.
Yeah, literally.
Email us.
Send us
So
an email.
maybe we could put out something via the app for anyone who wants to follow up and get their trusts involved in it. Right, there's another one from Rashid Saeed. Have you considered looking into the reason for the disparity among black women and other groups? Are they due purely to race or colour?
That's a good question, actually. So if you look at the Embrace reports in detail, you see that black women actually are not dying from anything more than what white women are dying from. It's just at a much higher rate, and they're clearly overrepresented in that data. So we can put it down to race, but it's not just about race,
Yes.
if that makes sense.
Yeah.
Yeah.
In what way, good question from Hania, do you think medical students and junior doctors can best help tackle these inequalities?
It's a good one.
That's the question at the top. Because obviously that's that generation who are coming in,
Yeah.
and they will be holding positions of authority. And speaking from my memory of the medical student, you might have a medical student watches you give birth, it's like, yeah, okay, you can adjust the radio volume. Obviously they are going to be the people leading things later on. What could they be doing to help?
I think one of the ways is something like that nursing book. It's a no-no. If someone says they're in pain, please listen to what they're saying, rather than how it's being said. Just listen to what they're saying. Also, I think it's the curriculum.
Can I just ask you to move your lanyard, because I think it's like you're muffling your mic. So you
Oh,
were saying
sorry.
That
much
nursing, that nursing manual was a real issue. Listen to patients. is what you're
Listen,
saying is
if
the
they
key.
say like they are in pain, listen to them. Because a lot of the time, from working in maternity, a lot of time, someone will come in and say, I'm in pain. It's like, they're in pain, but they shouldn't be in pain. So it's let them wait a little bit. No. Also, what's I going to say? The curriculum. It has to change. If it doesn't change, they're going to be learning from that curriculum. So no matter how much training they have, if they're learning from that curriculum, there will always be the disparity.
I think it's really difficult because remember there was that conversation we had with a student that
The
tutor,
nurse.
it was a student nurse, and the tutor was showing what a condition looked like, for example, on white skin, and the student asked and was like, so will I know what does it look like in black skin? What am I supposed to do? And the tutor said, oh, you'll know when it's in black skin. That was it. So
And that was at King's.
it's quite a difficult position that students are in, because it's so many things at a higher level that actually we're trying to change and affect that change. But until it comes from the top, it's
I think that thing you just need to have the data, so show what it looks like on different kinds of skins. So essential. Shona McLeod, great question. Do you think having a more diverse midwifery workforce would help? And I speak, I'm from London as well, I'm from South London, and by interesting coincidence, all the midwives that I dealt with were black. But it's striking from all the research you've done that black women are still having such terrible experiences sometimes. What's your view on diversity and its role in midwifery?
I don't think it matters. I've always said it. I
You
generally...
don't think that the diversity matters? It's just
It
about...
doesn't. I'm not saying if the head or midwifery is black, then, you know, everything will change at that hospital. There's a lot more to it.
Yeah.
Yeah.
And I think there's also something to be said for the medical curriculum.
Yeah,
We keep
it
drumming
goes
it
down to
home
that.
that if everybody is learning the same thing and what things look like on white skin, it doesn't matter if your midwife or the health professional
Or
is
if you're
black,
black.
because they're still not going to see and know what things look like in black
Yeah.
skin. So
if
I
you
think
haven't come across it as a black person, you're not going to know what it looks like.
literally.
Yeah. I just want to ask one more, because, where is it? Amazing work. What impact will the Ockenden report have on the issues you've raised?
That's a good one. So I know the Ockenden report has called
need
recently, there's a few things. So it's called for continuity of carer to be scrapped. I feel two ways about this. I feel like, well, with continuity of carer, actually my preeclampsia probably would have been picked up on time if I had the same midwife throughout my first pregnancy.
But I didn't have continuity
But you didn't
care,
have continuity
and I had a
care.
fantastic first birth.
Yeah.
So it all depends.
Yeah, I think it has to be the right set of midwives
Yeah.
that, again, know what the statistics are, know how to, know what the issues are so that they can adequately, you know, give the right kind of care. But also, with the Ockenden report, what we noticed when we were going through it was that there was not enough data. So there was a large chunk of data that was missing on ethnicity. So we actually don't know what a lot of the outcomes were for black and brown
ethnics,
people,
yeah.
because
They
their
hadn't broken it down
ethnicity,
into
their
that
ethnicity
level.
was not broken down.
Yeah.
So
Well,
they
had missing
or-
data.
yeah, they literally said they had missing data,
Data.
or people were mistakenly put down as white.
I think what's really come across is in the way that you use data and the way that you've explained the importance of what you do is it's so easy for them to have the data if they bother to ask the right questions. It's so easy to put on the curriculum, here are the range of skins and this is what these conditions look like. It's about adding things rather than doing one or the other, and it's not about accusation. That's come across so powerfully. As I say, I know that there are lots of questions, some of which are very specific still to come, including one about, you know, all women. But I think what's very clear, and you've already said it, is that all women would benefit from this kind of thinking across the board. It's about listening to women. Let's put up any links to your website and you know, other places that you've recommended for people who want to follow up. I know that everyone else has to now go on to the next workshop, which starts at, well, any minute now. So feel free to take part in any of them, ask for help if you need. There's going to be tea, coffee and networking after that, and another set of workshops, and I will see you back in here for the keynote from Charlie Massey. But can I just say, to Tanuka and Chloe, what an important, amazing set of work you do. Thank you so much for coming to talk to us about it, and all the best with it.